treatment on a trolley. This was Colchester's A&E last week. Staff and patients feeling the strain the NHS is under firsthand.
It's as bad as I've ever seen it in my career.
It's continuous pressure that's going on at the moment.
I'd happily pay a bit more tax if it means I'm going to be not staying in the corridor.
The Red Cross now claims a humanitarian crisis in our hospitals. At one, Worcestershire Royal, the deaths of 2 patients who spent hours waiting for a bed are under investigation, and 7 other trusts were so stretched in December they went to the highest level of alert, making them unable to deliver comprehensive care. Today, I asked the Health Secretary if he'd be happy to see a member of his family sent to a hospital under that level of pressure.
I would be happy to send a member of my family to the vast majority of NHS hospitals.
But not one on high level of alert?
Well, the ones, all hospitals have periods where the pressure gets higher. What we've seen over this Christmas period is a few hospitals which have had very sustained and difficult problems, particularly Worcestershire, but a number of others. Most hospitals are actually coping slightly better than last year, but we have got some examples where they've got real problems, and we're doing everything we can to sort them out.
In the meanwhile, the patients going to those hospitals should worry.
Yes, but I mean, in the case of Worcestershire, for example, we put that trust into special measures. The chief executive's gone. We've hired a new chief executive who's actually coming in from Australia. And we are working night and day to try and turn things around in that hospital. But this is the most difficult time of year, always has been, and that's why there are particular pressures.
It's the staff that soak up that pressure shift after shift. But this paediatrician is haunted by the thought that lives are at risk every day.
It was taking up to 2 hours to unload an ambulance with a sick patient into the emergency department, despite being right there. The sickness is also affecting doctors. Our colleagues on the night shift weren't able to come in, and one of my colleagues ended up staying 19 hours just to make sure ends meet. I'm really worried about what might happen in the future, and the worst case scenario is missing that sick child because you haven't got round to seeing them yet.
Most hospitals are coping with the pressure, but for those that aren't, tonight the Health Secretary announced a series of emergency measures to help them, including parachuting GPs into A&E and allowing hospital clinics and operations to be cancelled. It's a clear government acknowledgement the current situation is unacceptable. Catherine Jones, 5 News.